Hi there, welcome to Ask the Chiropractor, your source for ultimate health, healing, and chiropractic related information. I'm Dr. Adam Rodnick out of Commerce Township, Michigan, and we're here with our co-host, Dr. Alex Rodnick, also out of Commerce, Michigan.
Thank you, Doc.
Good to have you here. So we'd like to talk today about, we're getting into winter now, we'd like to talk about a few different things associated with winter that people often have health-related problems because of and cause injuries because of. Today we're going to talk about snow shoveling, we're going to talk about slip and falls on the ice, we're going to talk about fender benders, as a car sliding to the ice, minor accidents, and we're going to talk about asthma as associated with cold weather and winter. So let's get into snow shoveling first. I know we see a lot of people in our office that come in because they hurt themselves snow shoveling, or you can even throw in raking leaves and things like that before winter season starts. But definitely snow shoveling is a big one.
The big problem with snow shoveling isn't necessarily the act of doing it. It's that people have poor posture, poor ergonomics, and when they're lifting and they're twisting, and they end up causing an injury because of that. Now, I'm gonna pull up a model here. This is a model of the lower back, and you can see each individual vertebra, and there's a disc in between those. Now, what can happen a lot of times is when we're snow shoveling, we don't bend our knees. We're bending at our waist, which is wrong. That's the improper way to lift anything. And so when we're bending forward, it's actually putting all the pressure of our entire body down on these discs. So they're very strong, so they can withstand a lot of force. But you keep shoveling that snow, and eventually you end up hurting yourself. But even worse is when they're bent forward and then they twist, and those vertebrae can misalign. And when that happens, it can actually pinch off the nerves coming out through the lower back here.
So we have what we call a 10-to-1 ratio in these bottom couple discs in the spine. And you always hear people say, when you're lifting, bend with your legs, bend with your knees, and not your back. And of course that's true. But the reason why, that's what most people don't know, is that the back operates on a 10-to-1 ratio. So everything you're lifting with your back, when you're leaning forward, lifting with your back, you're putting 10 times the weight of that object directly as compressive force on the discs in the bottom part of the lumbar spine. 10-to-1. So if you're lifting just a 10-pound object, you're putting 100 pounds of pressure on those bottom discs. Now meanwhile, usually when you're bending over and lifting, you're not only carrying that 10-pound object, you're also bending over, an 80-pound torso, which is putting almost 800 pounds of pressure then on these bottom couple lumbar discs. And that's what can also cause the disc to bulge, herniate, or rupture. So we have a little model there to show what a bulging disc will look like. You could show that to our audience there, Doc.
Okay. So this is a disc herniation here. And let's see, we got a normal disc, should be nice and thick here, and give lots of space in between each vertebra for the nerves to come out. Now, the inside of the disc is actually mostly made up of water, and the water, it's kind of like a water balloon. Like if you push on it, the water moves around equally. Well, if there's one area where the outside of the disc, where it's mostly very dense ligament, gets stretched or torn, then the water part will actually push towards that weakest area. And so here you see it's a bulging disc is where the water kind of just bulges out just a little bit. And then once it actually pushes through, and this is what's called a disc herniation, where it's actually the disc is now going to be putting pressure right on that nerve.
And once that past that is when it actually ruptures, and it's a ruptured disc, then the fluid, the material is actually leaking into the nerve tissue and into the spinal cord.
And that's also called a disc sequestration.
And it's also called bad news for whoever it is.
Bad news bears, yeah.
Exactly. So that's a couple of big things on snow shoveling. So the biggest thing is that they bend forward rather than staying upright. When people are bending forward, again, they're putting that 10 times the weight onto those discs, onto that lower part of the spine. So the best way to snow shovel, we want to bend our knees slightly and keep our body upright rather than that bending out forward. And the other thing that we see a lot of people do, and of course also when they herniate the disc, these bottom few nerves, which you can see on our model here, they come down and they form the sciatic nerve. Now a lot of people hear the term sciatica, or they think they may have sciatica or sciatic nerve, and they have no idea what it is. So I'd like to explain a little bit to our audience what that is. These bottom couple of nerves here, as you can see, they come right down, and as they come down, this is the tailbone or the sacrum. As they come down through and past here, they go down the leg. So when people get that numbness and tingling or that radiating, burning pain or that lightning bolt type of symptom down their leg, that's what can be affecting the sciatic nerve. And usually what happens is the problem isn't down here in the leg and the sciatic nerve. The problem is most of the time right there in the lower back where it's irritating, pinching on the nerves or on the disc, where the disc is irritating on the nerve, and then it sends the signal and radiates that lightning bolt right down that nerve, down the leg. So a lot of times it can cause muscle weakness in the legs, and again, that numbness and tingling in the lightning bolt. So the other thing we see people do with snow shoveling all the time is they irritate or aggravate the ribs because they reach their body way out. Now if you look at someone from behind, you'll see that they have their scapula or the shoulder blade. It's like a big shield right around the ribs. So you see here my shoulder blade is a big shield right around the ribs where they attach the spine. The ribs actually, they come in and they attach to the spine on both sides. They come around the front, they attach to the sternum or the breastbone, and the ribs come around your body and they attach to part of the spine, what we call the costotransverse joints, is right where they attach. So a lot of times what happens with snow shoveling or with raking leaves or different things like that, people will reach out forward. When you reach the arm out too far forward, that scapula or shoulder blade will move slightly off the way and it won't act as a shield anymore around those tiny little ribs. And so what will happen is those ribs can move out of place just a little bit. Now imagine every time you breathe in and out deeply, the rib cage expands and contracts, So if one of these ribs is out of place here, every time you breathe in and out and expand and contract, you feel that stabbing, aching pain. So really stabbing, sharp, achy pain right in that same spot. And a lot of people have that and they have no idea what it is. They feel like every time they take a big breath, it catches them or it stabs them. And most of the time what that is pain in the ribs. It's a stabbing pain, and it's something that as chiropractors we fix very easily in our office, and it's something that if we leave there too long and someone has it for 9 months, a year, a lot of times their body will try to compensate, and unfortunately as they try to compensate, the body will try to turn in the sternum to take some pressure off, and a lot of times that can cause a little twisting in the pericardial sac and cause heart palpitations and really difficulty breathing. So eventually if people don't address it or if it doesn't go away on its own, it can cause some very major detriments to their health, but it's something that we can really easily fix. So if somebody does have that and they hurt themselves shoveling snow or raking leaves, so it's a very easy fix for us.
And for anybody who's dealt with this, they can tell you this is not a fun time. It's excruciating. Every time you try to breathe, it feels like somebody's sticking you with a knife, and it really is it's an easy fix in a chiropractic office. And we see several people who have already been to 3-4 doctors, went to the ER, thought they were having a heart attack. They said, no, your heart's fine, there's nothing wrong with you, go home. And meanwhile, they can't breathe, they're in excruciating pain. But for those types of people, I want you to know that you could see a chiropractor and about 3 or 4 adjustments to clear that up.
It's usually a very easy fix. And that's something that's really bypassed a lot in most of the medical community because it can be such a minor injury, but it can be so devastating to the patient. Right. And a lot of times what people will do is they'll check the organ systems and make sure the lungs are fine, make sure the heart's fine, but they're not looking at the structural alignment. So a lot of times that gets bypassed. People are just taking over-the-counter painkillers or muscle relaxers for this, but it's not affecting the structure where that rib is just popped out of place just really slightly, and it's really affects their daily lives. So let's move on and talk a little bit about, as the snow starts coming, slipping and falling on the ice. We see a lot of times that people, they didn't see the ice, it's on blacktop, so it looks like black ice, they didn't think it was there, and they slipped just a little bit. They either fell down, or a lot of times even worse than when they slipped and fell down is when they almost slipped, but they caught themselves, and they caused more damage to themselves than they may have if they actually fell. They did that little almost slipping and falling dance, and they caused a lot more damage possibly than they would if they fell. So when that happens, when they do the slipping and falling dance and almost fall, a lot of times what can happen is the muscles, they're using a lot of muscles they don't normally use to catch themselves to stay up. So these tiny little muscles, as they tighten up really hard in certain areas, especially where they're paraspinal muscles right around the spine, it's muscles they don't use as often, they tighten them really hard. And a lot of times it can cause the vertebrae to slip out of place just a little bit. And we can see here the green light is blinking, normal healthy supply of nerve supply here, no pressure on the spine, no pressure on the nerves, and they just slide out of place just slightly because what we call subluxation. It can cause some irritation or pinching in those nerves, just like we talked about. They can also have that in the sciatic nerve like we talked about earlier from the near fall and slipping on the ice too, but they can have that in other areas of the body. A lot of times we'll see people get those in their neck, maybe then get numbness tingling on their arms. We can see them get that in other areas of the spine that go to things that we don't necessarily feel that can affect organ function, the immune system, other things like that.
Mm-hmm. And one more thing while we're on this this nerve being pinched, I want to just talk just for a second. There's two things that can happen when those nerves get pinched. There's what's called a compressive lesion, which is where the pressure just actually compresses on the nerve, and that's going to slow down the signals going from the brain to the body and back up to the brain. And then there's another type, which is called a facilitative lesion, where it actually causes the signals to fire off rapidly. So we'll use a muscle, for example. So if the muscle has a compressive pinch on that nerve, well, now the muscle is not going to be getting the right signal. It's not going to be getting enough signal going from the brain to that muscle. So when you go to contract that muscle, it's going to be weak. You're not going to be able to have that full contraction like your brain's telling it to, because the signal's not all getting there. Now, on the other hand, if you have too much signal, now what do you think is going to happen to that muscle? Well, it's going to be contracting when you're not wanting it to. So you have muscle spasms or twitches from that same thing.
Now, a lot of times, too, with those muscle spasms, we have a facilitated compression. We have muscle spasms, and a lot of times, the body will actually try to cause a spasm to protect itself. Kind of like if somebody breaks their finger, right? We put a splint on it. The splint is to prevent it from moving in certain positions. A lot of times, the body will cause a spasm to prevent further damage and further pinching of the nerve tissue, things like that. So, a lot of times what people do is they kind of go against the body's natural instinct here, and we go right to the drugstore and we just get an over-the-counter muscle relaxer. Now, not to say there's certainly not a time and a place for it. Absolutely there is. Unfortunately, what people do a lot of times, they cause those muscles to stop spasming or stop tightening up, where they're now protecting, just like that splinter on the finger. And then a lot of times people can cause more damage because they go right back out and they put themselves in the position their body was trying to prevent them from going in the first place.
Right. So, if somebody has an injury, their body's, restricting them from moving a certain way. They should, if they go out, they can get muscle relaxers or painkillers so they feel better, but then they should rest and let their body heal up.
Let it heal. Most of the time, they want to take it so they can go back out and make it to the Christmas party and do other things like that. And of course, got to do what you got to do, got to get where you got to get. But we don't want to over-injure ourselves because of that, because we're now not feeling the problem that is still there. We're just covering it up with over-the-counter prescription medication.
So let's get back to the watching out for the slippery ice. So one thing we can do to help prevent this is make sure all of our walkways and places that we're going to be going to, are salted. But the most common way we see these injuries is when people are in a hurry, when you're rushing, when you're not looking down, when you're letting your body get ahead of your legs, and then it changes your way you're distributing your weight, and that's usually when people have these accidents where it's too late, they slipped and they're going down. It's
hard not to be in a hurry in the holiday season, but it's definitely something we should watch for. And we see countless times where people came in and they did the near slip on the ice or the actual slip on the ice and they landed. If you can grab the other model there, the compression fracture, Doc, and this is another thing we see oftentimes when people do land. Let's say they land right on their bottom, boom, hit right on their sacrum or their tailbone, or they land, they slip from an area and they fall right on their feet too, and they hit really down hard and they cause some compression here. What can happen to the spine is actually tiny little tears and breaks in the bone here. So this is a compression fracture or fracture of broken bone, but it's not what you think of when you hear somebody, let's say they were playing football and they broke their neck and they were paralyzed, or they broke their back and they were paralyzed. Not the type of fracture that will cause a paralyzation or paresthesis, anything like that. What it is just tiny cracks in the vertebrae because it had been compressed down so hard that it caused little teeny breaks here. And again, this is not going to cause the paralysis, but what it will cause is severe amounts of pain. And we see people with intense pain all the time that come in with minor compression fractures in the bones. And they never can heal 100% to what they were beforehand a lot of times. So it's definitely something we want to prevent as much as we can by being careful, watching out for the things like the slip and falls. So that's slipping on the ice. Let's move on and talk a little bit about fender benders. And this time of year, we see more of those than ever before, too. People slipping and going right off the road, hitting trees, hitting snowbanks, people just spinning their car, and then, of course, little fender benders.
Yeah,
Someone's parked
the
at a red
bad
light, can't
accidents,
quite
too.
stop. We see the skid, and of course the bad accidents too. But even these minor accidents, let's talk a little bit about minor accidents and major accidents.
Even in the minor accidents, they've been doing studies on whiplash, and even as slow as 5 miles an hour, 10 miles an hour, you can still cause severe whiplash in your neck, which is a big problem. And it can be very painful, and it can also lead to further problems such as arthritis if left untreated.
Now, I always talk to people about when something's out of alignment, kind of like a car. Let's say the car's out of alignment, tires are going to ball, parts are going to wear out faster. And the same thing happens with the alignment in the body, whether it's from improperly snow shoveling or slipping on falling on the ice or these type of car accidents. We can get alignment issues. When we have alignment issues over time, these joints wear out faster. Now, I take x-rays on people all the time, and I show them, you have arthritis in this area of your spine. They say, well, doc, I'm getting a little older. Of course, I should have a little arthritis now. Well, why would they have arthritis just here, not up here, not down here? If this vertebrae is out of alignment, which you can now see here, it's grinding on the joint, it's irritating on the disc, irritating on the nerve, majorly subluxated, misaligned. Over time, of course, this one is going to wear out faster than the ones that are in perfect, proper alignment. And so a lot of times what we see is people will have things like these fender benders in the winter, and they'll think nothing of it. They won't get their spine checked. They won't do anything about it. They think they were just a little sore or it wasn't too bad, or maybe they were sore for a couple of weeks and it got better. Now here we see someone 10 years after that happened, and now we see the damage that occurred over time. They planted a seed during that accident. Now over time, 10 years later, they started to get scar tissue in the area, major adhesions in the area, and of course, some of the degeneration and the arthritis. Also, as far as the alignment goes, when we have the type of whiplash injury, especially with more of the major whiplash injuries, we can see almost complete reversal of some of the structures of the spine, the curvatures here. We should have normal cervical lordosis, or a curvature arcing backward here in the neck. When we have a major whiplash type injury, the head is thrown forward so aggressively and so hard, we have minor or microscopic tears in all the muscles and the ligaments around the spine. And then they can heal wrong. The spine can be thrown out of position, and now it's arced forward like this. Now, if you guys can try this at home with me, take your hand, hold it up just like a nice curve here, and feel the skin in there. We feel how it's loose and relaxed. If we straighten our hand as far as we can, we feel how it's now tight, and it's pulling, and it's stretching. And that's what happens when we lose the curves, whether due to a whiplash type injury or due to just improper posture over years and years, or all sorts of different type of traumas, minor or macro or major traumas. We can start to lose these curvatures. And when that happens, it's now just like the hand. It's now pulling, stretching. It's tighter on the muscles, the ligaments, but not only the muscles and ligaments around the spine, also on the spine and the spinal cord and the nerves themselves.
Yeah, another thing about losing that curve in your neck that goes along with a whiplash injury is, like we were talking about, that degenerative arthritis. The way that the curve is aligned, it lets the joints sit on top of each other nice and even. And if that curve is straightened out, or even worse, is reversed, it's going to put abnormal amounts of pressure on those structures, and the abnormal pressure is going to cause those joints to wear out at an abnormal rate. And actually, a straightened curve can actually cause the joints to wear out at 2 times the normal rate. Now, if it's worse, if it's reversed, the head's all the way curved forward, it can actually wear out at 4 times the normal rate.
4 times the normal rate. That's amazing how devastating that can be to someone's spine. Most of the time, too, a lot of people don't realize or don't know about it, and they don't get their spine checked, and they have no idea.
Well, if you think about that, 4 times the normal rate of degeneration, that means every 10 years your neck is aging like 40 years. Now, some people might think that sounds crazy, but we see people in the office all the time that, I've seen 20 and 30-year-olds that had,
60, 70-year-old necks.
They look like they have 70-year-old necks because there's so much arthritis and bone spurs and disc degeneration. And at the same time, I've seen people in their 70s and 80s who don't have any arthritis.
40-year-old necks,
yeah,
exactly. So let's switch over now. We have a short video clip to show. This is Dr. Billy DeMoss out of California. And it's a little video clip he put together about chiropractic in relation to asthma. He's going to give a few tips about it. And then when we come back, we'll talk more about asthma as it's related to winter, constriction of the bronchioles, and some things we can do chiropractically that can help asthma, as well as what they do in their conventional methods. So let's go ahead and roll the clip.